When I meet with my patients, I tell them that I'm excited to be a neuroendocrine tumor expert because there's so many new advances recently. We have pill, that's called everolimus, that has been recently approved for the treatment of neuroendocrine tumors of the belly or gastrointestinal and lungs. We also have a new pill that can help to control symptoms such as diarrhea that was approved last year, and that's very exciting because diarrhea can really impact the quality of life of the patients. And finally, hopefully we'll have the approval of PRT, which I think will change the paradigm of treatment of neuroendocrine tumors. And patients that used to have to fly to Europe to get the treatment or to a specific center in the United States now will be able to do that in their hopefully home states and get paid by the insurance. So that has a significant impact not only on the treatment per se, but also in terms of the finances of the patients, because we should take into account all the needs of our patients. Gallium-68, or the NET spot, it comes to replace the octreotide scan, and this is great. Why? Because it's a one-day test. You can be done in 2 hours versus the octreotide scan that you have to come, do a shot after 4 hours, and then come back in the next day and do another picture taking, which is it's not very practical. So from the practical standpoint, it's great. But in terms of quality of the imaging, the gallium-68 can have a much better imaging quality, and the sensitivity of detecting tumors is more than 90%. And when you compare that with octreotide scan, that is typically 30 to 40%, you have a significant improvement of identifying tumors. And that has many implications because that will help the patient understand how much disease they have, but also will help in treatment decisions if someone should go to surgery or not, and where the surgeon is going to try to remove the tumors. That's very important. So for all that, I think is a technique that is coming to stay, and I'm very excited that got recently approved by the FDA. This is going to be a very exciting few years for neuroendocrine tumor treatment. There are new treatments that are up and coming. I think hopefully we'll get the approval of PRT, and then trying to understand where PRT will be used. I hope also we'll have some new exciting data coming with immunotherapy, and we'll be able to use that in the right patient. There is other target therapy medications that are being studied, like pills, and hopefully then will lead to more approvals. So I think the progress in neuroendocrine tumor treatment will continue to be very fast in the next few years, and it's very exciting to be a physician in the field. With the incidence of neuroendocrine tumors increasing, I think we need more physicians taking care of this disease and understanding this disease.